HIV, or the human immunodeficiency virus, is a virus that attacks the body's immune system. The immune system is our body's defense system. It protects us from infections and diseases. HIV weakens the immune system, making it harder for the body to fight off infections. When HIV weakens the immune system significantly, it can lead to AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of HIV infection. HIV is a global health challenge that has affected millions of people worldwide. Understanding HIV, its stages, symptoms, and diagnosis is crucial for prevention, treatment, and support for those living with the virus. HIV infection progresses through different stages, each with its own characteristics and challenges. Each stage is marked by specific changes in the virus's activity and the body's immune response, which can be monitored through various medical tests. The three main stages are acute infection, clinical latency, and AIDS, each representing a different phase in the progression of the disease. Acute infection is the earliest stage of HIV infection, often presenting with noticeable symptoms. It typically occurs 2 to 4 weeks after exposure to the virus, when the body is first reacting to the infection. During this stage, HIV multiplies rapidly in the body, leading to a high viral load. People may experience flu-like symptoms such as fever, headache, and rash, which can be mistaken for other illnesses. Clinical latency, also known as chronic HIV infection, is the stage after acute infection where the virus is less active. During this stage, HIV continues to replicate but at lower levels, and the immune system remains relatively stable. People may have no or few symptoms, allowing them to lead a relatively normal life. This stage can last for several years, even decades, with proper treatment and adherence to medication. AIDS is the most advanced stage of HIV infection, characterized by a severely weakened immune system. It occurs when the immune system is severely damaged, making the body vulnerable to infections. People with AIDS are susceptible to opportunistic infections and cancers, which can be life-threatening without proper medical care. Scientists believe that HIV originated from a type of chimpanzee in Central Africa. The virus is thought to have jumped from chimpanzees to humans sometime in the early 20th century. HIV is transmitted through specific bodily fluids including blood, semen, vaginal fluids, and breast milk. HIV transmission occurs through sexual contact with an infected person, sharing needles or syringes with an infected person, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. It's important to note that HIV cannot be transmitted through casual contact such as hugging, kissing, or sharing utensils. HIV specifically targets a type of white blood cell called a CD4 cell. CD4 cells are crucial for a healthy immune system. They help coordinate the body's response to infections. When HIV enters the body, it attaches to CD4 cells and infects them. The virus then takes over the CD4 cell's machinery, using it to make copies of itself. These new copies then go on to infect other CD4 cells. Over time, HIV destroys a significant number of CD4 cells. This weakens the immune system, making it difficult for the body to fight off infections. Imagine the immune system as an army and CD4 cells as the generals. HIV attacks and eliminates these generals, weakening the army's ability to defend the body. Section 5. Recognizing the symptoms of HIV. The symptoms of HIV can vary depending on the stage of infection. Some people may experience no symptoms in the early stages. However, common symptoms of acute HIV infection include fever, headache, muscle aches, sore throat, rash, and swollen lymph nodes. As HIV progresses to clinical latency, symptoms may subside. However, the virus continues to weaken the immune system. In the later stages of HIV, when AIDS develops, symptoms may include rapid weight loss, persistent fever, night sweats, chronic diarrhea, skin rashes, and frequent infections. It's important to note that these symptoms can also be caused by other conditions. The only way to know for sure if you have HIV is to get tested. Section 6. Diagnosing HIV tests and their significance. Understanding the various tests available is crucial for accurate diagnosis and effective management of HIV. HIV is diagnosed through laboratory tests that detect the presence of the virus or antibodies to the virus in the blood or saliva. These tests are essential for early detection and timely intervention. The most common HIV test is an antibody test. This test is widely used due to its reliability and ease of administration. Antibodies are proteins produced by the immune system in response to infection. They play a critical role in identifying and neutralizing pathogens. HIV antibody tests can be done using blood or saliva samples. Both methods are effective, but blood tests are generally more accurate. Rapid HIV tests provide results in as little as 20 minutes. This quick turnaround is beneficial for immediate decision-making and reducing anxiety for patients. Other types of HIV tests include antigen antibody tests and nucleic acid tests, or NATs. These tests offer more detailed information about the infection. In addition to HIV tests, healthcare providers use other tests to monitor the progression of HIV infection and guide treatment decisions. These tests are vital for personalized patient care. These tests include CD4 count, which measures the number of CD4 cells in the blood. A lower CD4 count indicates a weaker immune system, making the patient more susceptible to infections. And viral load, which measures the amount of HIV in the blood. Monitoring viral load helps in assessing the effectiveness of treatment. A higher viral load indicates more active HIV replication. Regular monitoring of these parameters is essential for managing HIV effectively and improving patient outcomes. Section 7. Early detection, the cornerstone of HIV management. Early diagnosis of HIV is crucial for several reasons. Firstly, it allows individuals to start treatment early, which can significantly slow down the progression of the virus and improve long-term health outcomes. Secondly, early diagnosis enables individuals to make informed decisions about their sexual health and prevent transmission to others. When HIV is diagnosed early, treatment with antiretroviral therapy, or RT, can suppress the virus to undetectable levels. This means that the amount of HIV in the blood is so low that it cannot be detected by standard tests. People living with HIV who achieve and maintain an undetectable viral load cannot transmit the virus to their sexual partners. Section 8. Living with HIV Treatment and Outlook. This section will delve into the various aspects of managing HIV and what the future holds for those living with the condition. HIV is now considered a manageable chronic condition, thanks to advancements in medical science and the development of effective treatments. With proper treatment and care, people living with HIV can live long and healthy lives, enjoying many of the same activities and experiences as those without the condition. Antiretroviral therapy, or ART, is a combination of medications that work by suppressing HIV replication in the body, thereby reducing the viral load to undetectable levels. RT is highly effective in reducing viral load, preserving immune function, and improving the quality of life for people living with HIV. Regular monitoring and adjustments by healthcare providers ensure the best outcomes. ART needs to be taken consistently as prescribed by a healthcare provider. Missing doses can lead to drug resistance and treatment failure. Adherence to ART is crucial for maintaining viral suppression and preventing the development of drug resistance. This means taking the medication at the same time every day without fail. In addition to ART, people living with HIV may need medications and treatments to manage other health conditions that can arise from having a weakened immune system. These additional treatments are essential for overall health. These may include opportunistic infections, certain cancers, and other chronic illnesses. Regular checkups and early detection are key to managing these conditions effectively. Section 9. HIV Prevention. Strategies for staying safe. Preventing HIV transmission is essential for controlling the epidemic. Effective prevention strategies include consistent and correct condom use. Condoms act as a barrier, preventing the exchange of bodily fluids during sexual activity. Pre-exposure prophylaxis, or PrEP, is a daily medication that can reduce the risk of HIV infection in people who are at high risk. Post-exposure prophylaxis, or PEP, is a course of medication that can prevent HIV infection after potential exposure. It must be started within 72 hours of exposure. Other prevention strategies include getting tested regularly for HIV and other sexually transmitted infections, or STIs, avoiding sharing needles or syringes, talking to your doctor about HIV prevention options. Section 10. The future of HIV research and hope. Significant progress has been made in HIV research, leading to more effective treatments and prevention options. Scientists are working towards finding a cure for HIV. Current research focuses on developing a vaccine to prevent HIV infection, finding new ways to eliminate HIV from the body, improving existing treatments and developing new ones. While a cure for HIV has not yet been found, the advancements in HIV treatment and prevention have transformed the landscape of the epidemic. Section 11. Breaking the stigma, a collective responsibility. HIV stigma refers to negative attitudes, beliefs, and behaviors towards people living with HIV or perceived to have HIV. Stigma can prevent people from getting tested, seeking treatment, and disclosing their status to others. It's important to remember that HIV does not define a person. People living with HIV deserve compassion, understanding, and support. Breaking the stigma surrounding HIV requires a collective effort from individuals, communities, and healthcare providers. By educating ourselves and others, promoting empathy, and advocating for policies that support people living with HIV, we can create a more informed and supportive environment.